So Brenda, tell us a little bit about what you've had, if you don't mind sharing what you've had done.
Yeah, absolutely. Yeah, I found out that I was diagnosed with arthritis in both hips as well as my left knee. And so far I've had my right hip replaced about 7 weeks ago now. And just about over a week and a half ago, I had my left hip fully replaced. And I'm scheduled to have knee surgery in about 6 weeks from now to get everything addressed.
So tell us a little bit about, I would love for you to share your experience, doing one hip and doing the other one so close together. Quite often we don't get to talk to patients. Usually patients will wait a year, 6 months or longer to get their other side done. And so you're in a really unique situation to kind of talk about the differences that you're feeling side to side and the experience that you've had.
Yeah, absolutely. My first hip was in a really bad state. I could almost not walk anymore with the pain that I was experiencing on that hip. And about the time that I was getting that hip done, I had just started feeling some of the pain in my left hip. So with my right hip, the surgery went very smoothly. I was up and walking the same day. I was off the walker actually after maybe 2 days and moved to a cane. I tried driving for the first time less than a week after surgery successfully. I did try to take it easy and slow adding activities because I didn't want to wear myself out too much. But it was a very smooth surgery the first time. The second one was even easier, which surprised me. And to me, I think the difference was that with the second hip, I'd already been doing exercises and other things to keep the muscles and tendons and things stronger. And I don't think that hip was as far along on the pain journey yet. And so it's interesting because before I had any surgeries done, I had 2 camps of people. There were people that would say to me, get it done right away, get rid of the pain, move on with your life. And then there were others who said to me, wait as long as possible. And my advice to people would be, get it done, because having that left hip done when it wasn't as far along, it's been so much easier. Already I'm doing laundry, I'm cooking, I'm resting in between, but I'm able to do most of my day-to-day activities.
And you're only almost, 8 to 10 days out?
Yes. Yeah, I just had the surgery a week ago Monday.
That is amazing. That's amazing. And so ultimately, what made you choose Dr. Goff? There's many different people you could have gone to. What was the tipping point for you?
Yeah, I mean, I think it was both the coming highly recommended from the physical therapist, reading the online reviews and just hearing all the really good things, as well as hearing that there are people that come in from all over the world to actually have him perform the surgery. And then when I visited, he really took a lot of time with me and made sure to answer my questions and didn't seem to be in any type of a rush to get somewhere else. And it just really helped make me feel confident, kind of pulling up the x-rays, showing me, answering any of the questions that I had.
That's awesome.
Yeah.
Well, thank you so much for sharing your
absolutely.
story. We really appreciate it. And I know that there's other patients out there that'll really appreciate hearing from you and your perspective, especially seeing that you've done both sides now.
Absolutely.
Yeah. So thank you.